Now some developing news on the Ebola outbreak in the United States. A second healthcare worker at a Dallas hospital has now tested positive for the virus. Officials are now alerting passengers who were on the same airplane as the woman the day before her diagnosis. The Texas Department of Health says a female nurse reported a fever on Tuesday and was immediately isolated at Texas Health Presbyterian Hospital. The Centers for Disease Control is expected to test the patient to confirm the results. Officials say the nurse, who is not yet being identified, lived alone and her home is being decontaminated. People who came in contact with her are also being monitored.
We continue to monitor 75 healthcare workers in conjunction with the state. And while I cannot discuss patient specifics, I can tell you this new patient was involved in the care of Mr. Duncan, the original patient whose passing we still mourn.
CDC says it missed opportunities to contain Ebola. Director Tom Frieden admits the government was not aggressive enough in containing the virus as it spread from an infected patient to a Dallas nurse. He originally said almost every hospital in the country can take care of Ebola. With the proper training and materials, Frieden outlined new steps designed to stop the spread of the disease, including the creation of an Ebola response team.
We will put a team on the ground within hours with some of the world's leading experts in how to take care of and protect healthcare workers from Ebola infection.
In Providence today, healthcare officials came together to share their strategies for tackling different diseases, including but not limited to Ebola. Let's get right out to Eyewitness News reporter Sean Daly. He was at that meeting and joins us now live at the Providence Mobile Newsroom. Sean?
Patrick, as the Ebola crisis rages on in West Africa, with fortunately only limited impact here in the U.S., we checked in with an infectious disease doctor here in Rhode Island. This is the 8th annual Vaccine Renaissance Conference at Hotel Providence. The medical experts here are keeping a close eye on the Ebola outbreak in Western Africa and on what is happening with this deadly infectious disease here in the U.S. Lessons are being learned.
I think that what we're learning from the exposure of the nurse in Spain and the exposure of healthcare workers in Dallas is that although we may have thought that people were adequately prepared and we really left each hospital to its own devices to kind of prepare for this, the potential transmission of Ebola, we're learning that actually people haven't been that well prepared and that the facilities weren't adequate.
Dr. Annie DeGroot is an infectious disease specialist at the University of Rhode Island.
What people should really be focusing on is making sure that we deliver adequate resources to West Africa, because the real problem is access to care in West Africa. And when we stand by as a nation and don't really seriously intervene in West Africa, that's shame on us.
Back here in the U.S., Dr. DeGroot is grateful to see the CDC decide to now send a rapid response team to every single case of Ebola.
I think the CDC needs to, instead of standing by and saying, oh, they screwed up after the event happens, they need to be present so that if there are breaches in the protocol, the CDC is observing that and correcting it before it goes too far.
Dr. DeGroot believes the stakes are way too high to operate otherwise. Live in Providence with the Mobile Newsroom, Sean Daly, Eyewitness News.